So we're going to move away from bariatric surgery per se, at least in the things that I do, and talk about some of the things you may be seeing coming down the road, or you've already seen them, that may be a part of your practice or your location. No financial disclosures, but I will disclose that Dr. Panala gave me a handful of his slides that I've included here too, so don't be too upset, Rahul. I didn't ask you to give the talk. You'll have. So we're going to talk about something called Plenity, endoscopic bariatric therapies, or EBTs, and those are balloons, endoscopic procedures, and devices, and then some novel surgical procedures that may or may not be appropriate in the future. So Plenity is actually a capsule. It's considered a medical device because it is not absorbed into the blood system. It doesn't act in any way as a medication, but it's cellulose and citric acid. It's FDA approved for patients who have a body mass index between 25 and 40, and essentially a patient takes 3 capsules before lunch and dinner, drinks a lot of fluid, and these things dilate up or absorb that fluid to hydrate to 100 times their original weight. So it's basically a stomach satiety mechanism. Fills up a quarter of the stomach volume, makes patients feel full, sticks around. There's also probably an intestinal coating process which prevents some contact and absorption. And it has some reasonable data compared to medical therapy alone. You can see patients had 60% of patients lost 5% of their body weight, 27% versus 15%, 10% of their body weight. So that's typically where when you look at the medications, that's kind of the range we're talking about, 10% total body weight loss at whatever time period, 6 months or a year, compared to placebo or controls. Most of those studies, the placebos or best medical therapy for obesity averages in the 5% body weight loss, and if they're significantly better, the medications or therapies will be about 10% body weight. So this is a little bit better than some of our medications, but not all that much better. They're patients who are diabetics, it looks like, they're more likely to lose 10% of their body weight, which has some implications for patients probably with a lower total body weight and who are diabetic. So you'll see the red asterisks here again. We're going to talk several endoscopic bariatric therapies that are gaining some popularity and some attention. In summary, they're less invasive, they're less expensive than a surgical intervention, whether that be a sleeve or a bypass. They're more effective than medical management alone, and they may fill a void currently in the obesity treatment. Some people have been talking about bridge therapy, so there's conditions like the diabetes or the weight before joint replacement that